Indiana University School of Medicine presents Professionalism for the Modern Physician, starring Dr. J. Montgomery Billingsworth III. Presented by the National Association of Tobacco Growers, because smoking today leads to a healthier and happier tomorrow. And Jim Beam Kentucky Bourbon, because Jim Beam Kentucky Bourbon makes you a better you. And now, here's Dr. J. Montgomery Billingsworth III.
Oh, hello there. I am Dr. J. Montgomery Billingsworth III, and today I would like to speak with you about professionalism in the medical setting. First off, I would like to congratulate most of you on potentially completing your first year of medical school. This short film is intended to point out and correct common professionalism pitfalls. You will see a series of film vignettes demonstrating both incorrect and correct manners of professionalism. One such key aspect of professionalism is knowing how to appropriately speak to a patient. Let's take a look at such a situation.
Mrs. Smith, it seems we have found some mild grade dysplasia on your cervix. Luckily, it's something we can take care of with a quick outpatient procedure and should be able to go home tonight.
Doctor, it is impossible for me to understand your big doctor words. They frighten and confuse me.
Obviously, that could not have gone worse. Mrs. Smith is clearly upset, and understandably so. Let us take a look at how that could have been better handled.
Mrs. Smith, unfortunately it looks like we found a little oopty-doop on your vajingo there. We're just going to go on and lop that thing off. You should be able to go home tonight.
Thank you, Doctor. In no way have you frightened or confused me.
As you have seen, it is important to simplify your language, so a mere patient can understand what you mean. Now let's take a look at another situation.
John, please read what's in the patient's chart.
It's Jeff, sir.
Whatever.
Okay, Mr. Edward has been diagnosed with Ebola hemorrhagic fever.
Mm-hmm. And Resident Johnson, can you tell me what the next 24 hours will be like for our patient?
It's actually Williams, sir.
Mm-hmm. Whatever.
Well, the virus will spread throughout the body, affecting every major organ. The patient will then begin to bleed profusely from every orifice. The pain will be immeasurable, and the patient will actually ask for the sweet release of death, but to no avail.
Well done.
I think we all know what went wrong there. Let's take a look at how that should have been handled.
John, can you please tell us what's in the patient's chart?
It's actually Jeff, sir.
Whatever.
Mr. Edwards has been diagnosed with Ebola hemorrhagic fever.
Mm-hmm. And Resident Johnson, can you tell us what the next 24 hours will be like for the patient?
It's Williams, sir.
Whatever.
Well,
wait a minute. Proceed.
well, the virus will spread throughout the body, affecting every major organ.
Mm-hmm.
The organs will liquefy as the patient begins to bleed from every orifice. The pain will be immeasurable, and the patient will plead for the sweet release of death, but to no avail.
Well done.
It is never appropriate to talk about a condition in front of a patient. They are not capable of understanding us. A patient deserves our respect and privacy, hence the curtain. An additional benefit is that it protects you from being drawn into lengthy conversations about a patient's particular diagnosis. Now, let us move on to a more dark side of medicine. Have a look with me at this next scenario.
Mrs. O'Connor, how are you?
I'm doing okay.
Good to see you. Great to see you. How are things at home?
Good.
Good. Keeping the house clean?
Always.
Husband happy?
Definitely.
Great. Well, you know that's the secret to, happy marriage. Huh?
Yeah. Got a pot roast in the oven right now.
Good. Yeah, that's great. Well, listen, I got some bad news. We got the test results back, and It's a cancer, some kind of cancer of the lung, but not treatment. Unfortunately, there's not a lot we can do. We can just kind of make you comfortable and work with this. You know, I know it's a difficult time for you, but we're going to be here to support you and help you through this difficult time. I'm sorry to break this to you. If you have any questions, you can call my secretary.
Wow, how awkward was that? Here's some pointers about how to break bad news to a patient. First off, always be brief. There's an old adage that says, the bandage hurts less when you pull it off all at once. Secondly, avoid eye contact at all costs. It would be extremely awkward for you, the doctor, if you ever happen to catch the eye of a patient. And lastly, remember to use humor to keep a situation light and to put a positive spin on an otherwise potentially difficult situation.
It's Connor. How are you? Great. Listen, we got the news. We got the results, and well, the truth is, well, you've had a good life, right?
Yeah.
There you go.
Wait, so I'll see you next month?
I wouldn't count on it.
How much easier was that? Now that we have taken a look at interactions with patients, let's examine how to appropriately manage the house staff.
Nurse, small work with that medical patient today.
That was unfortunate. I think we all know what the problem was in that situation. Let's take a look at it again.
Nurse, fine work with that medical patient today.
Thanks, doctor.
You got it.
Perfect. You see, one slap on the bottom can be misinterpreted as a simple, clumsy mistake. However, 2 slaps on the bottom lets her know that her work was really tip-top.
Well, it appears that you have syphilis, Mr. Paddle. Hello. Do you speak English? I will be your doctor.
You cannot speak English.
I don't understand you.
And here's another example of how your staff management skills will be critical throughout your medical career.
Well, it appears that you have syphilis, Mr. Paddle. Great. Nurse, we're going to need a translator. I don't know. Asian? I speak English.
He says he speaks English.
Even I sometimes require the assistance of a translator to help me with patients who don't have the common courtesy to speak plain English. Now that I have shown you what to do, you, the young physicians, have the know-how to conduct yourselves professionally at all times, no matter the situation. Now on a personal note, I believe you all have chosen the greatest of professions, one that offers money, power, respect, and of course, sex appeal. If there's any lesson I hope you've all learned today, it's that a good professional physician has absolute control of every aspect of medical care. Because after all, you're the one with the MD after your name. I mean, hell, it might as well be a GOD.